Hello, let us talk about a disc herniation. For starters, you should know that there are cartilage-type discs between your vertebrae or the bones of your spine. These discs work as shock absorbers and create space so that your spine can move. The disc is made up of an outer part that is quite strong. There is also an inner part which is a fluid-like substance, more like a gel. A herniation is like a tear in the outer layer. When this happens, the inner gel part bulges or leaks out. Pain is usually experienced when the gelatinous material is pushed up against a nearby nerve, causing pain that usually runs all the way down your arm or leg, depending on where the tear actually is. So, if this has happened to you, you may find yourself in quite some pain that does not seem to get any better. Listen up, this is the best advice you are going to get. This is going to take quite some time to heal. This is not something that will be fixed by the weekend, by the manner of speaking. It will require some time. Think in terms of weeks or months, not just a few days. Let me just show you how the spine, disc and nerves are put together, then you will understand how a disc affects the nerve causing pain. The bones are white, the discs are blue, and the yellow is the nerve. The nerve then travels down the leg, for example. As you can see, one of the discs begins to bulge out, shown in red. It presses against the nerve. As mentioned before, the adult disc has no blood supply, so it heals very slowly. So, what can you do? Firstly, get your mind set on the idea that the healing process will take some time. Much longer than you expect. Think in terms of weeks or months, not about days. Secondly, rest. Rest may mean doing pretty much nothing for a few days at first, depending on your situation. But rest also means getting things sorted at home or work so that you do not exert undue pressure on the disc. In fact, the worst movement you can do is bending forward and twisting your back. So, avoid vacuuming or raking leaves in the garden. For men, it means avoiding the chainsaw, whipper snipper, or leaning over your car and working on the engine. Walking helps when the time is right. Your chiropractor will give you advice on how and when to exercise, but also when not to. Anti-inflammatory medications may help, but opioid-type medications can often be avoided. Surgery should be considered as a last resort if there are complications. Your chiropractor will perform a neurological assessment of your situation to help determine your situation. An MRI scan may be helpful in confirming a disc herniation diagnosis. You now know that this situation will take some time to heal. Let me break it down a little for you. Think of a time scale of about 13 weeks. During the first 2 weeks, the inflammation process will likely get worse. Inflammation may peak after 2 weeks but then slowly subside over another 3 or 4 weeks. Allow 13 weeks, about 3 months, to heal as a guideline. Acute pain may last up to 4 weeks. More moderate pain follows and may continue for another 4 weeks. Pain may subside in the region of 9 to 13 weeks. Your chiropractor will monitor your situation and advise you of any needed changes during this period. Please allow your body time to rest and heal. Your chiropractor will continue to help you during the healing process. As always, your treatment is adapted according to your situation.